Hello and welcome to a very special functional forum. We are here in Birmingham in the UK for the first forum of the decade. It's called the Community Cure for the NHS. This is the home, the Hazelwell Hub, of the Birmingham Functional Forum meetup, led by Dr. Asfia Aftab, who you'll be hearing a little bit later. I've been waiting 14 years to do this forum. It's going to be really special. I'm so glad you're with us. Let's take a look inside.
One of my questions has always been with the functional medicine approach is how you scale that up. And I think this is just a fantastic solution that is touching on all of the issues around the foundations to health, so community and movement and nutrition and sleep and giving that place where people can change and change together. So I just find it really exciting as a GP and as a functional medicine practitioner that this is a very practical solution that I can take back to Nottingham, and really hopeful, I think, about reversing this tide of chronic disease within our nation.
The things that James has been talking about really resonate with me. Through the Tai Chi groups we've been doing, through the coaching support groups we've been doing around physical health and even mental health, making those groups so that people can talk more openly and then participate. It's almost like they take it in turns leading. It really made the group more powerful.
Without any further ado, I would like to welcome to the stage or to the altar James Maskell.
Thank you so much, Asfia. Thank you, everyone. Great to be with you tonight. Super excited to be here for so many reasons. I grew up about an hour away. I played cricket close to here growing up. And, it's just a very special place to be, not only because it's the Birmingham Functional Forum meetup, but also the way that I met Asfia was amazing, and I'll tell that a bit later. But also, this is a place where health happens. The last time I was in this room, back in June, I gave up my ticket for a World Cup cricket match to come and see what was going on, and to see 100 or so people, presentations, health creation, people who wanted to get healthy being introduced to each other. It was really special. So this building has a lot of great energy, and I'm so glad all of you here tonight to talk about a community cure for the National Health Service. So if you're watching this at home and you want to participate in a group or start a group, it's super easy to do. You go to meetup.functionalforum.com. You can start a meetup. We've had meetups on 6 continents, and what you'll see tonight is that the meetup infrastructure that we spent the last 6 years building is a really critical component to the future that we're going to advocate for the next 6 years. And so, all of the connections that have been made in groups like this around the world are a really important part of it. So on the 14th of January, 2020, it's going to be the release of my second book. It's called The Community Cure, Transforming Health Outcomes Together. It will be free for 4 days, from the 14th to the 18th. So if you're watching this, you can get it for free on those dates. You can go to thecommunitycure.com. Now, in that book, we talk a lot of American examples. There are some British examples in there, including some of the stuff we did with Guernsey. Dr. David Unwin, who I know did a talk here recently about his type 2 diabetes groups. But what I wanted to do today was to take the ideas from the book and really ground it into, I think, what's possible in the NHS. So thanks so much for being here today. So just to give you an idea of where we are, I mean, the NHS was started 70 years ago, right? So in 1948, it's a very different world than we live in right now. And we're going to get into that a bit. But just why does the NHS need a community cure? Is it in need of curing? Is there any symptoms that we can see that need to be alleviated? Is there a root cause that is perhaps not being dealt with? So, on here you can see the spending. I did my university in Nottingham. I did a degree in health economics. Good Nottingham crew here. But, when I was at university in 2000, we were on this upslope right here, right, where the cost was increasing almost exponentially. Now, we haven't really found a way to change that. As far as people really care about the NHS, when they're asked what's important to you in the government, what should we be tackling, people talk about hospitals, NHS, healthcare a lot, and the spending is going through the roof. So what I'm going to talk about today is I'm not a doctor, and people are always kind of surprised that I'm not a doctor because I started the Functional Forum. But what I am, or what I was, or what I think I continue to be, is a health economist. And ultimately what we have is a problem with resource constraints, right? A lot of times when I hear about what people think should happen in the NHS, it's kind of a fairy tale where there's infinite resources, right? Everyone should have a functional medicine doctor and whatever. Who are those doctors? Where were they trained? And how are they suddenly going to have an hour and a half to sit with everyone? That makes no sense. So ultimately, what I think you're going to hear tonight is a practical way of resourcing this transformation. And so some of it is going to be ideas that are already happening, some of it's going to be ideas that are new, and some of the things are going to come from America. Because the other thing, too, is America is further ahead in functional medicine, and there are mistakes that have been made in America that you don't have to make because we can communicate what's gone wrong, what's worked, and go through that today. And I just want to say one thing today, is that it's going to be a bit punchy, because I didn't come here to play nice, right? We're going to have a real talk about what's happening in this country and with chronic disease generally. And if it could be destroyed by the truth, it will be destroyed by the truth. So in that vein, let's get on with it. All right, so I'm going to give you 5 points today, 5 starting points of where I think transformation needs to occur and the baseline for the community cure, the 5 points. And the first is acute and chronic diseases are fundamentally different. Right? So in 1948, when we're putting together the health system, the first NHS, what are the kinds of issues that we're seeing, right? We're 3 years after the Second World War, right? We've got, just today, about 4 hours ago, a girl was hit by a car outside. Ambulances came. They did an amazing job. There's not many places in the world where it's better to get hit by a car than in England, right? We do a good job with acute medicine, right? But the health system wasn't designed for the diseases of today, and these are chronic diseases, and I want to show you kind of a little bit why. So you may have seen a diagram like this before, but ultimately this is sort of like the latest research into what goes into health. So 20% of what goes into your health is medical care, 30% is health behaviors, tobacco use, alcohol use, diet and exercise, 40% socioeconomic factors, education, job status, income, community safety, and 10% is physical environment, right? A doctor can't solve all these things, right? It's very clear that a doctor with a prescription pad can't solve these kind of things. And yet, this is an accurate reflection of where health comes from. And so we need to be grounded in this reality to think about what could actually be a solution. And I'm not the only person who's thinking. This is actually from the Journal of the Royal Society of Medicine. Ahmed Rashid actually wrote a paper, this was back in 2015, talking about a radical new structure for general practice in the UK, where some general practitioners are basically like primary care doctors, sort of the gateway to the rest of the system, and some are focused on chronic disease prevention and reversal, because these are very different jobs, right? They're very different. And so there's other people thinking about this. And this is why. My favorite word, and the word that you'll be introduced in the book, is biopsychosocial. And it is clear to me, and it must be clear to all of you, that chronic disease is biopsychosocial in nature. And I'll just give you an example, right? So something happens in the social environment, like loneliness, and we're going to talk about that a little bit later, triggers an underlying biological mechanism, i.e., let's say a genetic abnormality or just a genetic profile that leads to depression, right? So you see there's biological factors, there's psychological factors, and there's socioeconomic factors. And so you see this in chronic pain, you see it in type 2 diabetes, you see it in Alzheimer's. So if we understand that these diseases are biopsychosocial in nature, it might make you think that a biological cure is not reasonable, right? Is not a reasonable solution to a biopsychosocial input. And this graph proves me right. This is from Nature, 2015. For every person that they do help, the top 10 highest grossing drugs in the United States fail to improve the conditions of between 3 to 24 people. Right? So this is the top 10 drugs by dollar value, right? In the paper last week, there's all this consternation about who's going to be paying for these awesome American drugs that are coming over. the drugs don't work, right? It's really clear from this graph. So with Abilify, that's 1 in 5. With Crestor, as a statin, this is what I was talking to Dr. C. Malhotra yesterday about in lunch. The number needed to treat is 24. One person for every person that gets benefit. 23 don't get benefit. Cymbalta, 1 in 9. Humira, 1 in 4. Humira costs $5,000 a month, right? So if I say, we're going to be punchy here, I'm going to say that the experiment of doing chronic disease medicine with a drug-first approach is failing or has failed, right? Is failing or has failed, and ultimately, we can't just keep putting more money behind that failing plan. And you don't have to look further than this. This is called imprecision medicine because ultimately, we're moving from an era of medicine for the average to medicine for the individual. And you will see the reason why people don't all react the same is because there are biopsychosocial causes and there's just a biological input. So if you're watching at home, you can put questions on Twitter as we go through this, but I just wanted to lay a foundation. So if we know that acute diseases and chronic diseases are different, I just want to think that's like something that we're going to build on later on when we get to the community cure. All right, second, loneliness is the biggest driver of all-cause mortality. Right, so this again is an incredible statistic. Think about all the effort that we spend on teaching people to cook over here. Let's get them cooking. On the back, it's like growing healthy vegetables. Let's get people stopping smoking. All of the public health gains that we made in the last 20 years, getting people stopping smoking, getting people active, all of these things, and yet high social stress is a bigger driver of all-cause mortality than physical inactivity, alcohol, or smoking. And yet, we've created an environment where loneliness is not just the normal, but we have a significant problem. Look at this. British millennials, the second worst mental well-being in the world. A quarter of millennials say they have no friends. Young, successful, busy, but lonely, a generation empowered by the internet and plagued by loneliness. So, you could see in that situation, it's the biggest driver of all-cause mortality, and it's getting really bad really quickly. Because of the internet, because of the end of the social structure, because places like this church that we're standing in right now, that used to bring multi-generations together and create community, all of these different fabrics of society have gone away and led to the loneliest generation ever. So how's that going to work out? Are we going to see the same amount of unhealthy people in the future? Are the generation that are young now going to use health services at the same rate as their parents? They're not. They're going to be way sicker, right? And again, we have to get real about this because we can't just be like, maybe it'll just work out. The kids are all right. The kids aren't all right, right? And we need to start being real about why the kids aren't all right and preparing for the fact that they're going to use healthcare at a higher rate if we don't do anything different. So loneliness is a key driver. This was from Blue Cross Blue Shield. It was a report basically saying that millennials are sicker. Just today, Mohan Pal, who you're going to hear later, was showing me today that as of today in the UK, they downgraded the potential lifespan of people in England. They were too high with the estimates. And it's looking more like this, where major decline in health begins at age 27, right? So the event's called the Community Cure, right? You shouldn't be hooting and hollering at this bit, but we have to be real about what we're facing so that we can make real solutions to it. All right, so 3, functional medicine is the most appropriate operating system for chronic disease, and I want to tell you about this first. So, first of all, I just want any of you to take out of your mind what you think functional medicine is, what you've heard functional medicine is. If you've met a functional medicine practitioner and they do something like this, it doesn't mean that that's what functional medicine is. And it may be a bit of a crude example, but we're in a church. There's a difference between the word of the Lord and the behavior of priests, right? Can we agree with that? Right? So it's not the same thing, right? How it's been practiced in the first iteration and what it actually is are very different. Now, 14 years ago, I left England. Actually, 15 years ago this month, I was working in my first job out of university, and I was an investment banker in London. And I was sitting there I was at one of the Christmas parties, so it's almost exactly 15 years, and my mentor was hammered, and he just said, I've been sitting at this desk for 30 years. Don't do it. You'll waste your life. And 6 months later, I was on a plane moving to America, and I started working on the front lines of health creation. So I worked in a clinic that had what they would call naturopathic or integrated medicine, and within a month, I saw people transforming. Like, I saw health transforming. I saw people reversing chronic illness. I worked at that place for a year and a half, unbelievably well managed clinic called the Spa on Green Street. After that, I actually started selling to doctors, doing integrated medicine, and that's where I got sort of an N equals 1,000 experience of how this was being delivered in all these practices. And the reason why I'm so sure that functional medicine is the most appropriate is not because it's quote-unquote better than integrative or lifestyle or any sort of other word. The key thing is, can you scale it up, right? And you can only scale something up if everyone's doing it the same. And the problem with naturopathic or lifestyle or integrative or otherwise, the concepts are perfect. But if you speak to two doctors who are doing it, they're not doing it the same, and there's no system. And so, for 5 years, I was just going around meeting doctors, seeing what they were doing. Then I started going to conferences, and that's when I saw functional medicine. Now, you guys should all know that functional medicine works because you guys got a window in. And the BBC cheated a little bit because they didn't really show you what Rangan did, but Rangan was doing functional medicine, right? It's an hour show. They had to it has to be TV worthy, it has to be exciting. But behind the scenes, Rangan was doing epic workups with people. There was supplement protocols. There was all the things that he learned from coming to doing functional medicine conferences. That's where I met him. A year before Doctor in the House, we met at a conference in Colorado. And, this guy did something amazing in the UK. He showed everyone that chronic disease reversal was possible. And not just easy ones like type 2 diabetes. And I say that in quotes because your average physician doesn't think that's possible. David Unwin will tell you it's possible, and David Unwin will tell you exactly how to do it. But the easy things like type 2 diabetes in the first season, and then I think the BBC were like, yeah, let's see what this guy can really do. Cluster headaches, fibromyalgia, all this other stuff. And everyone got better. And all of those people maintain their health to this day, right? So you guys should have already known that functional medicine was better, but maybe you don't take your advice from TV shows. Probably smart. Well, guess what? October 2009, Journal of the American Medical Association. It doesn't get any bigger than that. Functional medicine. In this study, functional medicine model of care demonstrated beneficial and sustainable association with patient outcome measures. So this was in JAMA like a month and a half ago. And, integrated medicine, for all its value, has never really been featured like this because it can't be, because it's not anything, right? An integrative dermatologist and an integrative psychiatrist is both integrated medicine, but they're doing totally different stuff. Dean Ornish is doing stuff differently than David Katz. They're just doing it differently. And so it's very hard to quantify and organize. And so, for people who are sticklers for data, here we are. It's in JAMA, right? And the reason why functional medicine rocks is it's organized, right? And I want to just take a moment because whatever you think about what functional medicine is, this is functional medicine, right? Functional medicine is a way of laying out a patient case in a way that makes sense if you understand that chronic disease is a progression, right? It's not just a moment. One of the things that I think patients hate, right, is they're like, Doc, how did I get lupus, right? What happened? I was fine before, I had a few symptoms, but now I've got lupus. How did this happen? And either there's not enough time to say, or most people just don't know. But first of all, if you take an opportunity to do a timeline, and you see that from the age of 2 to the age of 6, you had 18 courses of antibiotics. It's like, da-da, the gut microbiome was destroyed, and things haven't been going so well down there for a while. And what I thought was just diarrhea was actually like pre-lupus. Right? There are pre-phases of all chronic illnesses, right? Pre-diabetes is obvious. Pre-heart disease is slightly less obvious, but still pretty obvious. Autoimmune disease is more and more obvious all the time, especially you can start measuring these antibodies, right? So there are pre-phases. So why is the functional medicine model so genius? The first thing is, it wasn't made up by one guy. It's not like one guy came up with it and we all have to be a guru, right? It was a bunch of doctors together who were working out, putting different papers actually in like an order and coming up with it. So the first thing is a timeline, right? A timeline is universal. Every doctor understands the timeline, but going back before they were born, going back to what their parents did, you're probably dealing right here, right now with, grandsons and granddaughters of coal miners, right, that have 2 generations of transgenerational epigenetics coming after them. It's obvious when you go to Vietnam and you see the grandkids of people that Americans sprayed with Agent Orange, but working in a coal mine is not so obvious, but it's still happening, right? So the timeline is like a universal thing, right? At the bottom here, you have the foundations of health, right? So sleep and relaxation, exercise and movement, nutrition, stress, and relationships, right? Relationships on this side. So the intake of functional medicine is biopsychosocial. The intake is biopsychosocial. The diseases are biopsychosocial. It's a match. And over here, you have the antecedents, triggers, and mediators, right? So you have retelling the patient's story and what actually happened. And then here, you have the 7 core processes. And ultimately, what they've identified is the 7 core things that break down over time between optimal function on one end and disease name on the other end. There's a gap in there, and that gap can be measured in function. And that gap is why we're getting so late on all these chronic illnesses, because we're waiting until the diagnosis, right? You can measure this. So why wouldn't you measure it? We're so far behind. But a reactive system can't get in the business of measuring it. It can't. It's based on pathogenesis. And what we're going to talk about today is salutogenesis. And we're going to talk about what the difference of those 2 words are. But here we go. Defense and repair, energy, biotransformation and elimination, transport, communication, structural integrity, assimilation, right? These are all processes in the body that if they break down will lead to chronic illness. We have to find a way of measuring those ahead of time, and this intake does that, right? It's a way for people to become conscious of how their chronic illness started and why it came along, and to really understand that. And in the middle here, you have the spiritual, emotional, and mental part of it. So ultimately, one of the reasons why this matrix is so awesome is because if I'm a health coach and I do an intake with someone and I fill out this whole thing and then I give it to a doctor, and that doctor's also trained in functional medicine, in 2 minutes that doctor knows a pretty good idea of what's going on with that case. That's really important. How thick are the files that you have to look at to understand where patients are? It's this thick. How can you get an idea of where people are? This is awesome. I'm going to tell you a bit later about innovation in this, where instead of a doctor spending an hour and a half with a patient to go through this, which is functional medicine 1.0, imagine a group of 18 people sitting in a circle and filling this out together. And why are they filling it out? Because they're the ones who are going to have to take the action on it, right? It made sense in the old model for the doctor to have the prescription pad and write out the prescription, because the doctor is the most important person in acute disease. In chronic disease, the patient is the most important person, and they should be writing this down, right? Every time their brain writes it down, it's going through the neural pathways, it's getting in there somehow. So we're going to talk about innovation in this, but this is why this thing's called the Functional Forum, right? Because as a health economist, I've been on a 14-year mission to work out how to solve the big problem at the beginning, the graph that just keeps on going up. Right? And the only way to solve that is self-efficacy. Having people be independent of the health system, not on pharmaceuticals, right? It's the only way. And I see a little bit of nodding, but I see a little bit of like, I'm not sure, James. It's all right. Think about it tonight. Get back to me. I'm definitely right? Okay. So these guys have done an amazing job. So if you go back, if this is the first functional forum you've ever watched, you're like, who is this guy? Why is he talking like this? Go back and watch last year. I came over and I did an event we did a functional forum on prescribing lifestyle medicine. The energy in that room of physicians, GPs, learning about basically functional medicine light here, prescribing lifestyle medicine, was amazing. Was the most awesome energy I've seen, and that's compared to even in America, right? The energy of the young doctors who are like, this is where I want to be. This is what I want to be doing. It was awesome. We captured it on video. You can watch it. All of our sessions are up online, but the next one that they have is on the 25th of January, 2020. If you haven't been, definitely check it out. Rangan is obviously the star of the show, but Dr. Ayan Panja has been doing functional medicine in his GP practice for years, and Mike Ash is basically the godfather. So you've got the three of them there. I highly recommend that you check that out. All right. So this is when we're going to get real about functional medicine, because this is my jam, right? I'm not a clinician. I'm not a doctor. I understand it, but this is why I started the business, the evolution of medicine. This is what we're doing. And the problem is, functional medicine, as it has been delivered, cannot scale to solve the problem. And there's 5 reasons why. It's unaffordable, right? So in America, most of it is done for cash. More and more it's being done on insurance. But in the UK, if you happen to live 2 miles from Ayan Panja in St. Albans, lucky you, because he could do functional medicine's GP session, but it's not easy to find because there's not many of them, because if you're doing 90-minute intakes, it's just not going to fly in a regular GP practice, right? And so a lot of people go outside the system and start their own private practice to do functional medicine, but straight away, we're not talking about any sort of cure for the NHS. Right? We're talking about the further destruction of the NHS by all the good doctors going to do their own thing, right? So it's been unaffordable up until now, right? It's been unaffordable. The second is it's been inaccessible, right? And it's inaccessible in a couple of ways. One, there's not that much of it happening already. It's not like it's on every corner. But secondly, if you want to participate in personalized medicine, you have to be empowered. Right? You can't change your diet if you're working 3 jobs and you're looking after your kids, right? There's a certain amount of functional medicine in the way that it's being delivered where it just makes this assumption that everyone can change their behavior at will. And the reason why they haven't is because they don't know enough or they're lazy, which is just, if you compare that to the people that you're seeing every day, it's not real, right? There's a lot of disempowered people in this country. There's a lot of people that are not doing it because they have a million other things on their plate, and, you know, it's like super rude to just, we'll talk about it in a minute, but to shout self-care at people that are not empowered enough to participate. Dr. Jeff Geller, who I'll talk about in a minute, he defines empowered as the ability to make new choices. And some people don't have that ability. So, even changing to a smoothie for breakfast might be out of their comfort zone and may not be something that they can do. So it's inaccessible. It's horribly inefficient, right? A 90-minute intake with your most expensive physician or your most expensive provider is a terrible plan if you're trying to make something efficient enough that can really be delivered to scale. 4, it's hard to scale because where are these doctors? Like, Rangan's doing a good job. They've trained, I think, 600, right? But there's not enough. It's hard to scale because you need more doctors to do the plan in Functional Medicine 1.0, where you have doctors doing everything. And the last thing is, behavior change is hard, right? I mean, building any system on a plan where everyone's got to change their behavior hasn't worked up until now, right? It's not really that easy. If it were easy and it was just something that everyone could do, it would have already happened, right? It hasn't. Not enough diet books. Diet books aren't going to do it, right? Doctor in the House on TV isn't going to do it. Behavior change is hard. So here are the reasons why functional medicine has, up until now, not been able to solve the problem. And this is a bit what I was saying earlier. I love this quote. Shouting self-care at people who need community care is how we fail people. So we're not going to do that, right? We're going to think about what the real solutions are. So, number 5, we've seen so many problems here tonight, right? We've identified why chronic illness has been done so poorly. And even when there's hope with chronic illness, like we can reverse it and functional medicine gets better outcomes than family medicine, it's not efficient, accessible, affordable enough to make any sort of change. But ladies and gentlemen, community is the cure. And before I get into this, to tell you about why this matters to me, I want to just give a special shout out to my mother, who's sitting there at the back and is here tonight. So first and foremost, I was the weird kid at school that did natural health, right? And I can remember, describing seeing a chiropractor to other kids at school, and they weren't really sure what that was. I can remember being the only kid at school whose mother had to be called before they were given antibiotics, right? So somehow in the 1980s, my mother, with no medical training, was able to to see 30 years ahead that there'd be some downside overuse of antibiotics, right? That was not even in the literature. That was just a thing so that always stuck in my head. And when I'm doing health economics, it's like I had a very different upbringing. And, you guys are going to be the first to know this because I kind of come out of the closet in my book. But I was born in a commune, right? I was born in an intentional community in Colorado. That's why I have an American passport. I lived in community here in the Cotswolds. I grew up in community in South Africa. And when I was 11, I left the community and I went to boarding school, and it was mental. But ultimately, the reason why I care about this is because the community that I grew up in was actually like the very beginning of the natural medicine movement. And I grew up in this weird world. And part of the thing that happened just after I had that moment with my mentor when I was an investment banker, and I was in a kind of a lucid state, and I just realized, I care about doing something of meaning with my life. And I think there's a possibility that the way that I was brought up wasn't just some weird thing that happened, but was a guidepost to what could solve maybe the most vexing problem on the planet. So that's why I'm super thankful that the community is the cure, and I've been looking through the lens of community at everything that I've done over the last 7 years to see where it is. So, first example of community is the cure, the functional medicine group visit, ladies and gentlemen. So imagine Dr. Shilpa Saxena. This is an average afternoon in a GP practice. All the patients are in their own little room, and we're going to do 5 minutes with each of them, right? 5 minutes, cut them off after 11 seconds, and then get your prescription pad out, give them the drugs, and move on to the next room because of the resource constraint, right? So the first time I heard about this was in 2013. It was 3 months before I started the Functional Forum, and Dr. Shilpa Saxena had heard about the drop-in group visit model, which is basically a drop-in model, and she was like, that's okay, but I want to teach these people, right? So one day she saw that everyone was a diabetic, and so she put them into a group visit. So instead of with the same billing code of a 15-minute visit, people got 90-minute appointment. So they got a 30-minute lecture, right, from either them or the health coach. This is the two-provider model. Health lecture on all things, like how do you get type 2 diabetes? Yes, you could eat at McDonald's again and again, but have you guys seen the literature about toxicity in type 2 diabetes, about insulin sensitivity and how it's affected by toxins? This is real. And so, the lecture here. And then here's this doctor taking people away for these semi-private sessions where you can do the stethoscoping or the vitals or whatever else you need to make it a billable encounter, because this is an American plan. So when I see the group visit, I'm like, this is amazing, right? You have the efficiency of the delivery of the information. And then this model was like a one-off group visit model. And I just heard the twinges of something that really stuck in my mind a long time, which is that, hey, hearing from this other person that also has type 2 diabetes that is a little bit further along is really inspiring and actually makes me want to do my behavior change. Hey, and maybe we should be accountability buddies. Maybe we should stay in touch, right? I was like, okay, there's something there, because now the pressure of behavior change isn't just on the patient and the doctor, it's being kind of shared a little bit around by everyone. And what I knew to be true then, and what is still true now, is that if we're talking about medicine from a resource constraint perspective, the only inexhaustible resource that we have is community. Peer-to-peer value delivery is the only inexhaustible resource we have, and we're using it at basically 0% capacity right now, right? If we rev that up to 100% capacity, all the problems go away, and I'm going to show you how in the next little while here. So I had that experience, and then Last year, I did a pretty wacky thing. I got my family onto a bus, and for 4 months, we drove around America doing events like this, right? Talking about some are to do with this vision, and some to do with like a community-based alternative to health insurance where functional medicine was the operating system called New Health. And we did that. And during that process, I saw something exceptional, and that made me think. That was last October, and I was like, this is the future. I want to jump into it. So I started doing a podcast series. And the first guy I interviewed was a guy called Dr. Jeffrey Geller, who is known as the godfather of the integrated medicine group visit. And this thing is like this because this is a podcast. You can go and listen to it. I highly recommend it. So Dr. Geller is working in the poorest part of Massachusetts, and is working with, very underprivileged, immigrants. Most of them don't have health insurance, and he's stressed out, and he's a first-year resident, and he's starting to see, hey, this person had a stubbed toe, and it was like the end of their world, and this person has a stubbed toe, and they're getting on with their business half an hour later. What's the difference in these people? And he realized that it was loneliness. And he started his first group he was thinking, what could I do if I could treat loneliness, right? Now, if you start a loneliness support group, how many people do you think are showing up to that, right? Not many people are showing up. So it was a type 2 diabetes group because people have got type 2 diabetes, they want to be part of a group. So he gets these people to come in, he gets some funding to do it, and ultimately he's the one that teaches me that personalized medicine is the future, but for people who are disempowered, it's a fairy tale, right? There's a certain amount of empowerment that needs to happen for people to participate in their care. So Dr. Jeff Geller, he created these empowerment groups. In his model, the groups never end. Right? At his model, they started as type 2 diabetes groups, but after, imagine in 3 years, you've talked about everything, right? There's nothing left to say, everything's been done, or whatever. So what does it become? It becomes a gardening club, or it becomes a dance session. They started doing salsa dancing, because really what they saw is people wanted to be together, they were solving loneliness, but they wanted to do healthy behaviors that would maintain, eat, relax, move, sleep. Salsa dancing is moving, right? Think of any healthy behavior, magnify it in a group, and it's that much more powerful. So Dr. Geller is the starting point. And as soon as I do that interview, I'm like, I'm doing a book. That was amazing. This guy is amazing. This is an incredible way of thinking about how can we solve the social determinants of health in a way. The thing that Dr. Geller said, which I think is really amazing, is that he had to stop himself from having the answers. He had been valued, and most of you have been valued in this room for your expertise for your whole life. So imagine now being in a position where it's not your expertise that's important, it's your ability to help each other people in the group solve the problems. And ultimately, that was like a big awakening. But the big moment, the thing that I had seen the year before was the Cleveland Clinic. So most of you guys know, on the 4th episode ever of the Functional Forum in May 2014, Mark Hyman announced the Cleveland Clinic on my show. That's kind of how it became big, because people are like, who are these guys? How did I just find out about this? So anyway, brief story on the Cleveland Clinic. They start doing functional medicine. It's the first academic medical center with real credibility doing functional medicine. What happens? Everyone wants to go, right? Everyone's showing up at the Cleveland Clinic, and within a year, they got a 2,000-person waiting list. One thing that you will learn about group visits, right? It's always a response initially to a resource constraint, right? It's always because, we don't have enough time, we don't have time, let's just try this and see what happens. So Tawny Jones, the best thing about the group visit movement is that the heroes aren't all doctors that are super aspirational that we can't think of being like us. Tawny is an administrator at the Cleveland Clinic, and she just works out that, she, through all the experience she's having, and they're doing the Daniel plan, all this kind of stuff, why don't we just have all the patients come in groups, and we'll teach them in 10 weeks how to take care of themselves. So this becomes Functioning for Life. And as of this month, January 2020, it is going to be available, and we are already fielding calls from hospital systems, major health systems who want to learn how to do this, because guess what? Functional medicine just got the Cleveland Clinic stamp of approval. Boom. And it works. And ultimately, this is how it works. They dangle the carrot of Mark Hyman. Hey, you want to see Mark Hyman? Go through a 10-week, 2-hour-a-week group visit run by health coaches, dietitians, and physician's assistants. And in that 10 weeks, they facilitate self-efficacy. People can read their own labs, people know what food to eat, and by some people the second week, some people the 5th week, some people the 9th week, they have a new group of friends. They have a new group of friends. You are literally solving loneliness. You are literally introducing people who want to get healthy to each other, and it's amazing. And I had an opportunity to see it, and I will tell you in a minute one of the reasons why there's so much about it, but this is about to happen. And there is unpublished data that will be published soon about the success of this model, and 50% of people get so much better they never need to see the doctor, right? Because they go through this process of finding others, they find self-efficacy, and it's being delivered not by physicians at all. And then this last podcast that actually only came out a couple of weeks ago, which I highly recommend. It's also, all of these are in the book, parts of it. It's called Open Source Wellness. And this is a psychologist called Elizabeth Markle. And in their group visit, this is unique, and I went to see it because it's not far from where I live in California. They don't just talk about doing healthy behaviors, they do the healthy behaviors in the session. So every session, they meditate, they exercise, and they eat in community. 16 weeks of that, and people transform. I interviewed a guy on one of the sessions where this is like a homeless guy, right? This is a guy who, like he said, didn't trust anyone, didn't know anyone, was scared, whatever, and now he's like wanting to teach other people what he learned because now he knows how to take care of himself. When you can take people from doers to teachers in 16 weeks, that is the basis for an exponential movement in healthcare because it's operating in a network. And one last thing, like if you really want to know, well, look, what's the mechanism here? Because what's happening, right? 15 years ago, we started to learn about the dose-dependent placebo response, right? So more time from your doctor equals more, you get better. Well, if greater attention from your health professional can induce a larger placebo response, what can the exquisite attention of 15 people do? Right? How many times have you been listened to, really actively listened to by 15 people? This is, whether you call it the placebo effect or the ritual effect, like Wayne Jonas calls it, there is something super powerful about getting people into a circle and talking about their problems. So, where functional medicine was previously unaffordable, now it's super affordable. Medicare, Medicaid, it can be done on insurance. And just think about it, like in terms of the structure. I mean, it's like in the past you had one doctor to one patient for 90 minutes. Now you have no doctors and 20 patients to one practitioner or two practitioners. The difference in those two things are incredible. Accessible. Now, this empowerment group is now accessible to more people and it can scale up. One of the biggest reasons why it can scale up is because it's profitable to deliver inside health systems. Now, that's not really as relevant here in the UK, but like integrative or functional medicine has never been profitable to deliver because it took too long. And so now it's accessible. It's super efficient, right? Fewer practitioners than patients. It's scalable. There's tons of nutritional therapists, there's tons of health coaches, there's tons of other practitioners that want to be involved with this that are super capable of running the group, so we can scale it up. And it's super transformative. Where behavior change was hard, now you have a group of people supporting each other to make changes. And that is the difference between, that's how it does it. And this is groups mapped to the biopsychosocial model. Basically, groups have an incredible effect for the individual, self-efficacy, self-regulation of emotions, mindfulness, a bunch of things. On the interpersonal level, creating new relationships. This is some of the reason why people are sick, because they can't build new relationships. Right? It affects that. It affects the whole organization because with self-care and the model, and it affects the whole community. And so group visits and the functional medicine group visit is a foundation for the community cure. But how would this look in the NHS, right? So is this even possible? Is there anything that we can take to learn from what we've seen so far? And I'm super excited to tell you that there is.
I had different people coming to see me, what I needed, and it gave me confidence that there is some good in this world.
If you become disconnected and feel lonely and isolated, it's very difficult to look after yourself as well.
When you get older, your whole life changes. Your children have grown up and gone, and I can't expect any person to keep coming here when they've got their own lives to be leading. I don't think anybody can explain what the loneliness is like. I was in a terrible state. I knew that if I didn't get somebody here to see me, that I would die.
So it's treating them with kindness and compassion and listening to their story and understanding where they are in their life and what needs to happen next to make that better. Right, how are you?
Very well, thank you.
You were saying that you felt quite isolated?
Yes, I did. But coming to the club, we got into a little circle of friends and we all got to know each other, and it was nice seeing each other.
We always give them, I always carry some brochures with me and I can give them the brochures, and when they get a hold of the health centre, the Health Connecting, then they're able to point them in the right direction.
We can just help people to get in touch with the support that's out there. There is so much support, and just to help people not feel sort of isolated, really.
We've got that 500 people who on average will talk to 20 people a year. That's 10,000 people put in touch with those resources.
They phoned up one day and they said they'd got this male that would come to see me, and that was the best thing that ever happened. And I can't I can't tell people what a difference he's made coming.
For every £1 that's spent on this scheme, the NHS is saving £6. And the joy of this project is that you see the huge impact it can have on individuals, turning their lives around, being given back a sense of being part of a community again.
Isn't that amazing? Yeah. So simultaneously that's happening in Frome, and it's really exciting because it's a proven model inside the NHS, but it's also, they're looking for funding, and it's not like that there is support behind it. But what I wanted to do was to put that in context, because ultimately this leads to that. So the book, you guys are all going to get a copy of the book, but if you're watching this at home, 14th to the 18th of January, you can get the book for free online. I want you to download it and share it with whoever you want. The reason why I self-published this book, and we're making it available for free, and it'll be very cheap after that too, is we want to make sure that as many people as possible listen to this. So you have full permission from me to rip it off as the owner of the book. All right. So what we're really talking about here, and sort of like I want to give you this is the final chapter of the book, which is called The Community Cure. And what the community cure is. And ultimately what we're talking about here is we're talking about building sort of an alternate entry point for chronic disease. Acute disease is doing great. If it was unburdened with the chronic disease patients that shouldn't be in it, it would be doing a lot better. And we're talking about building this kind of system from scratch. And ultimately, what we have to think about is, what is the baseline by which we could build this? Is there an idea out there that already exists that would give us the mental framework by which to do that? And there is. It's called the therapeutic order. and it's from naturopathic medicine. And I think this is an idea whose time has come. As an economist, it makes sense to me because we start with the least costly, least invasive interventions first. You know, if we live in a world of iatrogenic disease and death, it makes sense to me on a human level. But essentially what we're doing is we're starting with the least costly, least invasive interventions first. So the first thing is establishing the foundation for optimal health, dealing with the social determinants of health, right? That's what's happening in those groups in Froome. No matter what the group is, they're dealing with the social determinants here. Stimulate the self-healing mechanisms. In my book, you'll hear about Jim Gordon going to Kosovo and Puerto Rico after the hurricane, and Gaza, and reversing 80% of people's PTSD with mindfulness-based stress reduction in a group, right? So acupuncture in a group now becomes affordable. Mindfulness-based stress reduction in a group becomes affordable. Support and restore weakened systems. That is functional medicine. That is also, that is here. Physical alignment. This is where we need the osteopaths and the chiropractors and everyone else involved, because basically if your issue hasn't been solved by these three, we're just moving up until we do get a solution. But we start with the least costly, least invasive intervention first and move up. Natural symptom control. So this would be use of natural substances to palliate. And then synthetic symptom relief. This is drugs. And high force intervention. That's like surgery and chemo and everything else up there. So ultimately, my version of this is empowerment groups, modality groups, and nutrition groups. And this is the same group, right? In the Cleveland Clinic, this is all the same group. Sometimes it's different groups, but this could all be the same group. This is a foundation for everyone for the future of chronic illness. We have some integrative therapies that we'll need, but are way less if we're doing this right. One-on-one functional medicine is up here. So you don't get to the one-on-one functional medicine unless you go through all these levels, just like the Cleveland Clinic, and then pharmaceuticals and surgery. That is a system built on salutogenesis, built on health creation, where pathogenesis is in its rightful place, the last resort for chronic disease. For acute disease, it makes sense for it to be first, but not for chronic disease. So there's only one thing that I dislike about the naturopathic therapeutic order. Can you guess what it is? Ladies and gentlemen, we are ending the era of the pyramid. It is time for the era of the circle. And the circle is a more effective way of translating. You remember how the food pyramid went to the plate? Still not ideal, the plate, but you know, it's better than the pyramid. So this is it. Culture, community, coaching, care, and cost sharing. So how does this apply here? You know, it's using a minimum amount to get the maximum amount of benefit. So culture, how do we affect culture? Rongan's TV show. The BBC has a remit to deal with this, right? We all pay for those, we all pay for the BBC. We should have a lot more content on all channels facilitating a transformation in culture towards health creation. 2, community. This is everything that we could be doing. Did you love the health connectors, the health coaches? But the community connectors, if you want to keep the NHS, right, you got to play that role. Right? And you've got to get people in the community to play that role. Their only role, they're not a health coach. They're not telling you how to sleep or anything like that. They're just showing you where to go to the website to find a group. They're going to show you about the talking cafes. There were 5 talking cafes in Froome that had office hours where health connectors were sitting there, and these cab drivers are just telling people, go to the cafe. You don't even have to buy a tea. Just go and speak to these people, and they'll tell you in the right direction. Coaching is an affordable layer of one-on-one care, or it can be done in a group as well. I'm part of a men's group where there's definitely some coaching happening, right? I go to CrossFit, there's definitely some coaching happening, but these are group structures. Care, obviously functional medicine, but all the other care that's involved is here. But these are 3 layers that we build outside of care. Right now we go straight into care. And cost sharing, I think that the reason why this whole model will work is because NHS is a cost sharing community. Fundamentally, like what Asfia is doing with her smart care, she is dealing with the care of 80,000 people. And so cost sharing is where it is. And the one thing that I would say about cost sharing, how it could be made awesome, is more transparency, the better. Right? The more transparency we have about where we know where money is going, the more that everyone feels connected to the community. And they know that if, like in Froome, imagine if people are like subsidized or whatever, if they save $3 million or £3 million by having people not go to the emergency room, if that was some way filtered back to the community that did that, now you have an economic transaction or an economic incentive to be healthy and help your fellow man. So that's the Community Cure. That's been 14 years in the making. I really appreciate the opportunity to come and share, and I'm absolutely thrilled that we have in our midst tonight 3 people who are literally doing it on the front lines, if not here, then very close. So please welcome our panel over here. We'll have Dr. Asfia Aftab, Dr. Mohan Pal Singh, and Susie Glasky. We're going to have a little panel here.
If there's one takeaway that I would want to tell doctors, patients, or just people in general, then that would be read the book, The Community Cure.
So I remember watching my daughter doing synchronized swimming, reading his first book, having reversed my own illness using the functional medicine approach. And I read his book and I got to the end of the page and I thought, that's it, I can never go back to how I have practiced medicine. And it was that made me do the functional medicine training. Now he's ruined me again, because now I've done the functional medicine training and I'm practicing as a functional medicine practitioner, but now he's given me a solution to go back into the NHS and bring a solution to our wonderful health system. So he's ruined me.
He's incredibly passionate about what he does. He's seen this from an economical perspective, which is really refreshing, because one of the big burdens on the NHS is the financial burden. And it's great coming at it from a clinical and a health perspective, but ultimately the improvements in the NHS are twofold in terms of what we're looking to achieve. Firstly, it's patient outcomes. That's absolutely vital. But secondly, is to make it more financially sustainable for the future. And if we can achieve both of those things, I think we're in a really strong position. And that's where James's background is so unique, to bring clinicians together with the financial modelling side of things, to bring the two and really improve that patient experience in an affordable and scalable way.
So I want to start with you, Mohan. You know, we met first out of I think the 3 of us. So maybe I met Susie first, because Susie comes to America. But I met you, and when I first met you, you were already into the group visits. And I'd just love for you to share your experience of doing it in Birmingham with the population that you're working with.
Yeah, so I'm a GP in Birmingham, and I think probably about 4 months before we actually met, we started a little project called Healthy Lives, and we were seeing people for one-on-one kind of behavior change, motivational interviewing type of conversations, and that had some great outcomes. But one of the things we noticed really, really quickly was that, you know, the power of being able to transform someone's perspective is so much more enhanced when they've got a group of peers around them. So one of the first things we set up was a walk with the doctor group, which still goes on today. So we've got a bunch of doctor volunteers who take a bunch of people out for a walk, and then they're getting some exercise, getting some fresh air out in nature in a beautiful park, but then they're also having some of their medical questions answered, or a little bit of training, a little bit of teaching, and having a great time. So that's one thing that was set up just before we met. But then another thing that we've been doing now, actually across the NHS, I think I know of at least 20 different people who are doing type 2 diabetes groups at a practice level. And that's something that we've been doing now for about a year. And it's going really, really well. Every single person who's attended our group has had an improvement in their health parameters, which is, you know, more than can be said for the kind of traditional treatments for type 2 diabetes that we can say. And they all feel amazing. And you see in the group that, you know, it's useful to have a healthcare professional there, but not always essential, because they gain so much from each other rather than from the healthcare professional there. So groups, I think, are becoming, you know, there's something that people are taking an interest in, and I can see it probably becoming mainstream.
How do you get people excited to be in a group?
Oh, you just got to sell it to them. And I think when they come, this is the thing, getting people in is the challenge, if there is a challenge. But once people are in, if you've got a good kind of group, very positive kind of vibe there, they just have so much fun that that sense of fun and enjoyment is what brings them back every single time.
Beautiful. So Asfi, I want to ask you, because you know, you've obviously been involved in this. Tell us, everyone, for the people who don't know and the people at home, what happens here in this building every so often?
Yeah, so I'm Asfi Aftab. I'm a GP in the NHS, and the good NHS, you know, with its transformation fund, allowed us about 18 months ago to be able to put what was a dream in my mind into reality, and I think that's just been absolutely fascinating and absolutely fabulous. But what we decided to do, because I do have a clinic nearby here, is to ask the hub here, which is the Hazelwell Hub, which includes this church hall, if we could use their space, which they were very happy to allow us to do, just to say, can we bring some patients together? Can we, use the community space somewhere where they can feel safe and they can just talk, So I found that I was talking one-to-one, but not perhaps making the health transformation that I wanted to do. But what I did find was that everybody were really interested in their root cause of their issues, whatever they may be, and how I found that the environment was probably one of the biggest sort of health issues, more than the biomedical model that I had been taught. So what we did was to say to people, do you want to come to somewhere where you can feel better about yourself? Our strapline was, let's get better. And they said, yeah, sure, doctor, because we've tried everything else. It can only get better. So they did, and there'd be maybe 20 people in the beginning, maybe 40 people. We had a member maker model, so that's where we include everybody that's here today. So the members were people who were referred into the system, and the makers were all of you who are the healthcare practitioners who give up your time to come here, perhaps give a talk like you did today, talk about the 4 pillars. But the greatest thing we found was that there was that peer-to-peer support that Mohan, you talked about, and they were talking to each other and sharing sourdough recipes with each other and making it for each other. And there was we called it the Happy Hub, just it's like a term of endearment about it, because we didn't really know what to call it. It was just, let's all get together, let's teach each other about what causes just health and well-being, what makes us feel good. And it was what you said, which is relationships and connecting. And what I really found was the connection was more than any of the education, the information, the Tai Chi in the corner and the art therapy in that corner. It was just the fact that they were doing it together, and they didn't know what they were doing, and they didn't really know what they were saying. There were people from the ages of 18 to 97, but they were all talking to each other, and it was just fantastic.
Yeah, the energy in here was so great, and I think it's a great opportunity for practitioners to come together. Susie, I want to just ask you, because I know you've been doing groups in a slightly different situation than in the NHS. Do you want to share a little bit about what that's looked like for you and what you've learned from it that you think could be valuable to everyone else?
Yeah, sure. So I started doing groups mainly in corporate settings. So I do work a lot with companies around the UK. And I'd seen so much success in just getting a group of people, 15 people around a table, and just getting them to open up. So whether it was about their sleep or their, maybe they go home and it's wine o'clock and they're opening a bottle of wine and, swallowing 2 packets of biscuits just to cope with life. And then they're up till 12:30 at night on YouTube, in bed, scrolling through the iPad. And that is the reality for a lot of people who live in the UK, as you guys probably know. And that isn't solved by just telling people, well, you need to get 8 hours sleep and, you need to stop eating sugar. We know that doesn't work. So having seen that success, I approached my local hospital where all my kids were born, which is Wythenshawe Hospital. And I asked if I could come and do a workshop with some of the staff there, which I did earlier this year. So that was around 20 people. Unfortunately, there were quite a few people who couldn't make it because they were off with stress-related symptoms, which is very telling. And I made it very, very interactive. So not only tackling things like food and movement and sleep, but also I talked about connection. We talked about getting out in nature. We talked about getting in a state of flow and finding some time for themselves in their ridiculously busy day to do 5 minutes of whatever it was that lit them up. So for one person, it was embroidery. Another person, it was playing the guitar. I did breathing exercise. I showed them mindfulness exercises. It was challenging because their beepers were going off. It was in the middle of the day. But over the course of the 4 weeks, and it was only 1 hour a week, over 4 weeks, there was the most huge transformations. And I actually measured these. So I gave them They filled out a form beforehand, so it was a medical symptoms questionnaire, and also the Promise 10 form, which tracked things like how often they'd felt anxious in the previous week, and then measured again after 4 weeks. And just the most remarkable transformation, so things like 65% reduction in medical symptoms across the whole board. But more than that for me was the hope, and you can see it I made a very short video, which perhaps you can put a link to, and you can see the hope on their faces because they felt empowered, and for the first time they felt that they didn't have to continue in that vein of being overstressed and all the rest of it. And they then went away and spread that to their families and to other people in their departments.
Absolutely. Beautiful. Well, it's great to start with the staff. I mean, I think that's something that you were talking about as well, Asfia. I'd love for all three of you actually just to give a quick thought as to what you see the sticking points are in this scaling up in the way that I've described. Because it seems like there's a lot of momentum. Well, maybe each of you could take a minute on each. Where do you see the significant support momentum points that you see in your world? And where do you see the sticking points will be? Do you want to go first, Mohan?
Okay, this is really snowballing this year. NHS England have recently announced their kind of plans for the next couple of years, and they are totally on board with bringing the power back into the community. NHS England are funding 100% of the salary of what they're terming as social prescribers, which is very similar to the community connector model that you just saw in the video. These are not clinicians, but these are people who be seeing our patients, or you could just call them people, yeah? And they'll see them for an hour or two, and they'll see them multiple times, not just linking them with local activities, but also even going the extra mile, even going with them, or generating new activities in the community. And so part of it is about linking someone to things that already exist, but part of it is about building community. Because you're talking about the biopsychosocial model, but I think for far too long we've actually said that one person's medical problems are their own, but no man is an island, and almost all of the symptoms that we see are in some way due to a broader social context. I work in one of the most deprived areas of the country, and this is exactly what I see every single day. So things like social prescribing, the NHS are getting on board with, health coaching, the NHS are getting on board with. So in terms of system drivers, a lot of the challenges now are being handled, tackled, dealt with, and we know that the NHS is with us in that, which is fantastic.
Well, Asfia, I'd love to get your thoughts on it, just because as a GP partner being responsible for 80,000 people across all of these different clinics, where do you see the opportunities and where do you see the sort of sticking points?
So the sticking points would be, we need to open up our minds and our horizons and start getting more into the integrated care, working collaboratively, and just realizing the possibilities, dreaming more about how we can actually do it. Don't worry about being realistic. Don't worry about being a critic. I think we need to dream big because it's happening. It's happening in parts of the world. It's happening really close to home. And, and all of you who've been involved in it, I think we need to just let go of limitations and say that there are enough of us now who think that we can do this, and there's enough inspiration out there from all parts of the globe now where we can look to and we can learn from. And I think working at scale, through federations, through networks, which is what's happening in the NHS, is a way forward. Bringing the sort of NHS and the private sectors together closer, using more interdisciplinary, multidisciplinary workforces that perhaps we haven't looked at before, looking more at mindfulness and biomechanics and, sleep in different ways, and not just telling and instructing, but asking, the solutions are out there. Like you said, it's solutogenesis. Let's forget the pathogenesis. Let's forget the firefighting. Stop concentrating on the crisis. We need to get to the prevention so that we can make a difference. Otherwise, we will just constantly be firefighting. And I don't think any of us want to do that. Patients don't want to do it. The health system can't take it anymore. And I think we need to start on the ground.
Well said. Susie, what are your thoughts? Health coach in the room?
So I just want to say that this solution is so simple. I mean, I ran a workshop last week with a group of women, must have been about 15 women, just on how you change habits, because as James has said, behavior change is really tough. And at the end of it, a woman came up to me and she said, you know what the most powerful thing for me this evening was? 2 words, community and compassion. So it wasn't any particular bit of information that I shared. I didn't have any handouts, but it was no information or statistic or fact. It was the fact that all I had done was facilitated this group of women to share with each other. And once one opens up about how they find it really, really hard to get off Pinterest at 1 o'clock in the morning and everyone is nodding and listening with respect and empathy and compassion, is the simplest thing in the world. There are hundreds of people like me who are skilled at doing this. You can just look up the UK Health Coaches Association. They are ready and raring to go to facilitate these groups. So I just want to make the point that it's so simple. Yeah. And the sticking point, I think we need a lot better PR. I think people just have not heard of this. And I say that as somebody who was an ex-PR consultant. I used to run a PR agency. I just think the awareness is not quite there yet.
Well, I will say one thing. So, you know, and just for everyone here, like, ultimately, it's going to take participation for everyone to take this whole thing forward. And part of that is the PR. So, you know, I spoke to Dr. C. Malhotra yesterday. We had lunch. If there's one thing he's been good at is getting press for his concepts. You know, Dr. Chatterjee's podcast is being listened to by really important people and it is moving in that direction. And, you know, ultimately the purpose of this book, you know, the purpose of my first book was really to give, if I gave it to a doctor and they read it, at the end of it, would they say, oh, I think I should do functional medicine, right? But it was really about them leaving the system and doing their own thing. Whereas this next book, the goal of it is that if you give it to anyone, if you gave it to any other GP partner, right, in the whole of the NHS, would they read the book and in 2.5 hours, 3 hours that it takes to read it, at the end go, we should be doing functional medicine group visits throughout the system, or we should be connecting people to these resources. So I hope, Susie, that like the reason why I wrote the book and the reason why we're giving it away for free and the reason why I've maintained the rights to the audiobook so I can give that away for free too is because ultimately we just want as many people to hear it as possible. Because these issues that we're having here in the NHS are no different than America. In fact, you know, there are a lot of things about it that's better. Like, I love the NHS. It's taken amazing care of my mother. And, you know, and in America right now, the things that they're planning to do here, like privatize the NHS, is exactly what we're trying to get away from in America because it's been a horrible failure. So, you know, it couldn't be a more apt time. You see what's happening in the press and, you know, with this election, like 10 days away. By the time this show comes out, there'll be, you know, either a different prime minister or the same prime minister. I mean, something will have happened. And, you know, at that point, who we should send this book to will be different. But ultimately, I'm counting on you and all the people who are listening to this, and all the people who are watching this, to say, look, this could be your moment. You could be the connector, and not just like the social connector in a community, but you could be the community. You could be the person that puts this in front of a doctor or the CEO of a hospital or someone who could just make a decision to say yes. And that's ultimately the community cure. Right? The community cure is people participating together to solve a problem that we all want to solve. How awesome is the new face of the NHS, ladies and gentlemen, right here? All right, we've got time for a couple of questions before we wrap up. Any questions here in the front row?
The mantra that's been chanted at the moment is more doctors for the NHS. I would argue that we've got this the wrong way around, that we probably need fewer doctors. And I think we actually probably need to reduce our budget. To stopping the escalation is not big enough, because this is a great bottom-up movement, but thoughts on how we apply pressure to CCGs, government, to actually say we should be reducing the NHS budget, because that's actually what we need to do, I think.
What do you think? Fewer doctors, more doctors?
I don't mind fewer doctors, more doctors, but whichever doctors they are, they need to get into root cause medicine, they need to get into prescribing lifestyle more, we need to connect more as a society.
Mohan, any thoughts on that?
Yeah, I think what a health service does needs to fundamentally change. I think getting into more coaching and preventative work and actually health creation rather than, you know, a national illness service.
Yeah.
It's an NHS, not an NIS. Yeah.
I think one of the mental blockages that people have to get around is it goes something like this. You know, in the pathogenic system, if the doctor does the wrong thing and gives the wrong drug, it could be a real problem, right? People could die. And so we have these whole systems set up around getting getting the doctors well trained and in the right place, get the best diagnostician here at the front doing it. And I would just say that in salutogenesis, the downside of people meditating slightly wrong or eating slightly wrong is almost zero. In America, there's got this National Association of Detoxification Acupuncture, where it's been like teaching peers how to do it. And it's not that those peers will ever have the skill of like the grandmaster acupuncturists, but now we're talking about access, right? Now we're talking about availability. We're talking about ways for people to do it, because doing the ear point slightly wrong or the acupressure, the downside of it is zero. And so when we shift our mindset away from a fear-based, disease-based mentality and towards a health-based, solution-based way of thinking, we start to realize that a lot of the things that we're fearful of and people doing things wrong are less important. And the real importance is getting people to actually want to participate. And the power of peer-to-peer, I'll say this again, that the community, peer-to-peer value, people participating is the only inexhaustible resource we have. And we have a resource constraint. Right, and so I just want all of us, as we go forward, to think about, you know, the ways that we can be that much more efficient, so that we can play within those resources, because eventually, you know, it has to run out some way or another. One thing I just want to ask you guys about, just really about vulnerability, right? You know, I think that vulnerability is not a thing that a lot of people are searching for in their lives, right? That they're not thinking about. But one of the things that I've heard time and time again is that people will be more honest with a group of their peers than a health professional. And I'd love to just get your thoughts on that as people who have done those things.
What will happen in a group is you tend to have someone who's more vocal and then other people who are more quiet. That's just a normal group dynamic. But for someone to sit and say, you know, I'm on antidepressants, I really struggle to get sleep, and I take comfort in, you know, a bottle of wine, etc., and not be judged, for no one in the room to kind of tut or roll their eyes, but all they get is compassion and understanding. And it's that helps them heal. You know, if you ask any health coach, certainly for my clients, you know, if I ask them what was the most helpful thing, it's like, Susie, you never judged me. You know, whatever I came and said that I'd done or hadn't done, I said I'd do this, and you never, ever judged me. And people need that. They just need a safe space, and they will work it out for themselves. People are very resourceful. You know, they have everything they need. They just need somebody to support them and be the cheerleader, and they'll get there on their own, you know. They're not stupid. They know what to do. You just need to give them that support without berating them and bashing them over the head, just being there. And it's the most powerful thing.
Wonderful.
I think in England we used to have these adverts where people are walking down the street and their blood pressure's flashing in front, on top of their head, like hypertension is a silent killer. Do you remember those adverts? Do you remember seeing them? You know, it's okay. But I think loneliness and unhappiness is also a silent killer, because every single person puts on a mask. You get up, you get ready for the day, you put a mask. When you go and see your healthcare professional, you put on a mask. When you're at work, even with your family member, 24 hours a day, everyone has a mask on. But then when you come into a group, you access literally what I can see is the only thing that can break through that mask, which is what's just been said, which is compassion. Compassion, forgiveness. Let's look at what's strong with you, not what's wrong. And that happens in every single group that I've been a part of. And it's a beautiful thing.
Thank you.
I think what another great thing is you know what I alluded to before about how within groups, you know, you learn so much more, but then so do we, and we are just as vulnerable as practitioners. We are also citizens, we are also patients. We can also work in groups, and we can have compassion in the workplace. And people like Isabella Natrins is sitting here, who's helped us do pilots. It's exactly what we're doing with our patients. She's doing it with our staff. And we need to remember to look after ourselves as well, because, just as you said, the vulnerability, nobody has a badge of vulnerability on. And patients often think that we're not vulnerable. And, you wouldn't understand, doctor. But we're all in exactly the same place. And when we do these groups, I think patients realise that we are all the same, and we learn just as much. Mohan, you've been doing the Happy Hubs with us, and we learn from the patients, and the patients learn how to jump up and down and do laughing yoga with you, and that's great. You learn so much about things you could never have imagined, So, and I think that's a great thing that, we can all learn, and we all need to have more compassion and more connectedness.
Absolutely. I think the one thing that group visits really does transform, that is underrated, and maybe the reason why this breaks through, is physician burnout as well. I think that so many physicians don't get to see the fruits of their labor. They don't get to see people get better. And actually watching that happen over a period of time is unbelievably satisfying. And I think that's part of the sort of the moral conundrum that a lot of physicians have found themselves in. So I just want to finish by saying, look, this solves a lot of problems. It's super exciting to be here to share this. This is really a dream come true. 14 years in the US, having grown up here, and I think it was really the first 7 years really just seeing what was going on, and the last 7 years having an opportunity to sort of express myself, and just what is really amazing, and what you guys will hopefully start to hear more and more of, is just the degree to which decision makers are showing up and saying, we want to do this. And there have been places that this medicine has never gone, inside health systems in the US, in the UK, and everywhere, and those people are showing up and saying, help, we don't know how to do this, and we know that it's possible. And so I'm super grateful. I want to give a special shout out to everyone who's in the book, everyone who I interviewed for the book, and more importantly, every one of you who is doing the work out in the front lines, whether that's one-on-one or in groups or otherwise, because one thing that you learn from this is that we are so much more interconnected than we think. And that ultimately the impact of empowering people one-on-one or in groups, the ripple effect of that goes out into communities and families and in the social structures that already exist. And so I want to thank everyone at home who's watching, everyone who's here tonight. This has been the Functional Forum. Thank you. Good night.
The main take home is, there's a ground up thing happening. Hopefully massive social prescribing change can happen in the NHS, and it's really great to see such a big movement.
Brilliant to listen to, great solution, great presentation, really workable solution, makes it very accessible and understandable for whether you're a medical profession or not. And I love the fact that it's using such a wider team. Like, it's not all about the doctors, it's about that wider team. So it's really exciting.
From an osteopathic perspective, we're always outside of the NHS system. But now having seen how community can be gathered together to make changes with James's whole model, and how it can actually be part of the NHS. It doesn't have to be a system outside of it. And we can work together. That's the biggest thing we've learned today.
Yeah, so community is really powerful, and we learned that community is powerful through what he was saying, and he showed us results, which was brilliant. And in my head, it's ticking already that what do we need to do in our practice? What changes do we need to start implementing to reach out to the wider community of Hall Green and Birmingham?
I think a lot of us, whether it's doctors or nutritionists or dietitians or so many allied health professionals, were working in isolation. Nobody's really putting it all together. And I think what was amazing about today was just seeing that vision that actually we can all work together on one particular model and be making people better.
Panelists are wonderful. Asfia, Mohan and Susie are fantastic advocates for what we're all trying to achieve from very different backgrounds, from GPs, GP partners and health coaching as well. So a very multidisciplinary approach. And I think the key fundamental similarity that they all shared tonight was their passion for really delivering this service and integrating this new model of care into a very complex and quite rigid and not so open to change organisation as the NHS is currently. That is changing on a quite rapid basis moving forwards because it has to.
The biggest thing I noticed when I've been involved in any sort of rehab programs with patients is that when the chronic programs are medic-led, so information-led, the retention is really, really low. But when they've been patient-led, and so I've been there facilitating them, the retention has been really high, like 90% or more people have stayed, and it became more like a support group for each other, and they motivated each other to do all the stuff that we're doing, which is great.